About 200 years ago, Voltaire, the famous French philosopher, said that the art of medicine is in keeping the patient amused whilst nature takes its course. Now, I'm sure you will recognize and realize that the body has a incredible power of recuperation, but hopefully over 300 years our health care services have improved enough that access to healthcare will actually make a difference to outcomes. And it's not just a question of keeping the patients amused whilst nature takes its course. Having said that, Voltaire was right, because it's not just a question of access to healthcare, it's a question of access to good quality healthcare. And with those of us who were present for yesterday's, for the Medical Association's seminar yesterday on the social determinants of health, and indeed those of us who were present this morning for the People's Forum, will have heard how important employment, education, lifestyle is in shaping our health outcomes. But not just. It's also a question of access to good healthcare. And if you look at people in one single society, where the health service is uniform and is the same for everyone, you'll see that there are different outcomes. So outcomes in one given health system will depend not just on what's available, but also on whether you have had a good education, whether you have good social support, whether you have enough money and enough resources to shore up the healthcare that you receive. Now, this is in just one health society, let alone when there are differences between health systems in different countries and in different regions. And you can imagine the differences in outcomes that you will see in these populations. And the Commonwealth is fortunate in being able to address and to link these major differences that we have in different parts of the world. The difference between the Commonwealth and other organizations is exactly this. The WHO, the World Health Organization, for instance, is organized into regions, which is fine. But if you look at any single region, the difference between areas or countries within that region, whilst they exist, are usually not as great as you would expect, as you would find between different parts of the world and between different regions. And the Commonwealth is one of the few organizations which can bridge these differences, because there are countries from Europe, there are countries from Asia, Africa, North America, wherever. So there's an opportunity here for not only improving access to healthcare, but also improving healthcare itself and making that access worthwhile and giving better outcomes. Now, this is the Business Forum, and I'm really pleased, and it's fantastic that the Business Forum is discussing health. And obviously, there's an interest for business in healthcare. If you're in the pharmaceutical industry, then it's in your interest that there's more access to medicines because you're going to sell more medicines, or there's more access to vaccines because you're going to sell more vaccines, which is fine. If you're in the hospital building industry, then you want access and you want policymakers to build more hospitals, because that's going to give you business, which is fine. But I think the major point of why business and healthcare need to come together is that we've heard yesterday, as I was saying in the social determinants of health forum, that richer people have better health. But it's also the other way around. Healthier people are richer. And you can only have a healthy economy if you have a healthy society. If you look at who the poorest people are in any society, you'll find it's the unemployed, chronically unemployed. It's the single parents, single mothers usually, who have poor social networks. And it's the chronically ill. The chronically ill people are usually the poorest people. And it doesn't matter what background they come from. If you're ill, you don't work, you probably don't have enough friends, and you end up poor. And if you have an unhealthy society, then you will have an unhealthy economy. And if you have an unhealthy economy, then the business community is going to suffer. So it's in the interest of the business community that society is healthy. And this is where business has to come in. Being Commonwealth countries, more or less, to a lesser or greater extent, we are all influenced by the British NHS, which is a fantastic system. But the NHS is a social service, and I believe healthcare needs to be a social service. It needs to be excellent, it needs to be accessible, but it also needs to be sustainable. And as a social service in itself, aiming to be excellent, it's impossible to remain sustainable. So healthcare systems need to have a business model that works. And the best people to advise healthcare professionals and healthcare policymakers on a business model that works are business people, which is why it's excellent, that you are organizing this seminar here, this meeting today between business people and the healthcare profession, because we need to remain a social service for sure, but we also need to make our systems workable, our systems sustainable, because otherwise we will fail. And as Lord Kicker said, the way forward is to bridge together these two, the healthcare system and the business community, not just as a business opportunity, but also because we recognize that unless our healthcare systems make business sense, then they will not remain sustainable and they will fail themselves. They will fail the business community, but most importantly, they will fail the patients and the community we live in. I'm very looking forward to hearing the rest of the panel, but I'm sure we'll be able to take up these and other points later in our discussion. Thank you very much.